Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them drama-free. This episode explains pseudostratified columnar and transitional epithelia, tissue types named for their appearance rather than their cell shape. Try these cues before we start. Which epithelial type contains umbrella cells? What do you call the adaptive change in which one mature epithelium is replaced by another? In action. Pseudostratified and transitional epithelia are named for their appearance, not their cell shape. Pseudostratified columnar epithelium, or PCE, only looks multi-layered, but actually isn't. Transitional epithelium changes its appearance depending on how stretched it is. PCE consists of a single cell layer, though its nuclei lie at different heights, creating the illusion of multiple layers. Every cell touches the basement membrane, in contrast to true stratified epithelia, where only the deepest layer contacts the basement membrane. Basal cells are small stem cells that rest on the basement membrane but don't really reach the lumen. Basal cells continuously replace worn-out cells. Ciliated PCE lines most of the conducting airways, particularly the nasal cavity, trachea, and bronchi. In these regions, goblet cells secrete mucus that traps dust, allergens, and microorganisms before they reach the lungs. The cilia then beat in a coordinated direction, moving the mucus toward the throat, where it's swallowed or coughed out. This process, called mucociliary clearance, protects the delicate lung tissue from inhaled particles, helping keep the airways clean and reducing the risk of respiratory infections. Years of cigarette smoking or vaping, as well as uncontrolled asthma, chronically irritate the respiratory lining, triggering changes that can be maladaptive. Goblet cell hyperplasia, an increase in goblet cell number, leads to chronic bronchitis, marked by a persistent phlegmy cough and shortness of breath. Squamous metaplasia involves replacing ciliated cells with stratified squamous cells. Though tougher, this epithelium retains mucus, increasing the risk of recurrent respiratory infections and breathing difficulty. Non-ciliated PCE lines the epididymis and ductus deferens. Instead of modal cilia, these cells have stereocilia, long, non-modal, actin filament-based projections that are actually modified microvilli, not true cilia. The epithelium's increased surface area enhances absorption and secretion. In the epididymis, stereocilia absorb excess testicular fluid and secrete proteins that promote sperm maturation. In the ductus deferens, stereocilia absorb a small amount of fluid and secrete substances that help sustain a favorable environment for sperm until ejaculation. Male infertility can result from damage to the epididymis or ductus deferens. Infections causing inflammation of these areas, as well as scarring from conditions like trauma, can disrupt maturation or transport of sperm. Transitional epithelium is a stratified, non-ciliated epithelium. Its superficial cells, called umbrella cells, are large, rounded, and often binucleate due to incomplete cell division during maturation. When stretched, these cells flatten without separating from one another. The apical surface of umbrella cells contains uroplakin plaques, which are specialized transmembrane proteins that reinforce the cell membrane. Transitional epithelium is also called urothelium because it lines much of the urinary tract, including the renal calyces, renal pelvis, ureters, urinary bladder, and proximal urethra. Transitional epithelium's main function is to stretch as urinary organs fill with urine and return to their original shape after emptying. This epithelium also protects the underlying tissues from the harmful components of urine. Tight junctions between superficial umbrella cells seal intercellular spaces, preventing urine from leaking into the surrounding tissues. Uroplakins in the surface cells also make the epithelium highly resistant to urine contents. Urothelial damage allows urine and its irritating components to leak into underlying tissues, causing inflammation, bladder area pain, urinary urgency, and dysuria or discomfort during urination. Urothelial injury may result from various causes, including infections, radiation therapy, such as for cervical cancer, and chemical irritation from certain medications, for example, the cancer drug cyclophosphamide. Let's review. Which epithelial type contains umbrella cells? Answer: transitional epithelium. What do you call the adaptive change in which one mature epithelium is replaced by another? Answer: metaplasia. Got both? Take your walk of fame. If you find this episode useful, smash like, share, and subscribe. Thanks for watching. Stay sharp with Med in 5.